So it started when I was about 21 years old, playing cricket. It was the first time my back went. I was just running up to bowl and sort of pulled up and couldn't really move. That was about sort of a couple of weeks of really being very immobile and sort of slowly going through physical therapy and sort of getting back to normal, which took a couple of months. And then this sort of set me up in a pattern where for the next 9 years or more, every probably 6 to 9 months originally, my back would go, normally from a sporting exercise, squash, tennis, cricket again. And then in the last few years, it sort of became, the time between episodes became less. So it was happening every few months by that point. And, I'd then go through a few months of physical therapy to get better. And then, a couple of months later, it'd be back at where I was again. So I had surgery about 6 or 7 years into having had sort of these episodes and back pain. I wanted to do sort of the least invasive surgery possible, and so I had a microdiscectomy. I was told that the chances of it sort of returning were extremely high if I was only doing that. So at the same time, I had this dynamic stabilization device put in. It was a silicone spacer between the vertebrae. It was a fairly long recovery period from that. It took probably 6 months of physical therapy following that to feel like I was in a good spot. But then I think I had maybe 9 months to a year of feeling pretty good, and then it sort of, I think the disc slipped again, and so I was sort of back to where I was before. I'd stopped playing squash, cricket, not really playing tennis anymore. I'd stopped running. I couldn't really do much in the way of sport or physical activity. So that was one thing, and then just general day-to-day pain was the other. So I was, struggling at work because sitting for prolonged periods of time was hugely painful. I couldn't travel long distances because I'd sit on a plane for more than a couple of hours and I'd be in huge amounts of pain and unable to just sort of sit. So it was a huge influence on my life. So the first month after, it was interesting. It was I didn't have the procedure when I was at my worst, so it wasn't like a sort of black and white and a night to day sort of situation, but it was more of a gradual onset, I'd say. I was sort of feeling better, but I was also I'd taken a couple of weeks to rest, and so I was sort of also very rested as well, which I think was probably helpful. And so, I think it was only after a few weeks where I started to feel, maybe this is like having an impact and an effect, and sort of starting to be a bit more confident in it, but trying not to get ahead of myself. So far, I've been now doing yoga regularly for the last 2 months. I went skiing 2 weeks ago. I've been at work and pain-free pretty much for the last probably six or 7 weeks, and so it's been it does feel like I'm very much on the right path there. So. I'm going to build up to doing things like tennis and squash, but I feel like I'm 100% on the right path, and certainly very pain-free compared to where I was a while back.